We have a number of members who are also friends of ours on Facebook, and we like the idea of people liking us or friending us on Facebook because that offers immediate communication whenever we have a new training or some issue that we have advocacy needs from the members to take a look at and help us advocate for school health. Today we're very blessed to have Kevin Jennings joining us from BeTheChange.org, and Kevin is going to be our lead presenter. After Kevin and after I do a little bit more housekeeping, we're going to have Susan Limber. Dr. Limber is professor of psychology at Clemson University. Speaking with us from the team in Milwaukee at the Children's Hospital of Wisconsin, Bridget Clemente, who is the director of Children's Health Education Center there. She's ably supported by Dick Schafer. Dr. Dick Schafer will be speaking at the April conference with Part 2. Dick is the manager of research and development at Children's Hospital in Wisconsin. We would like many of you to look at the possibility of joining the American School Health Association. We know that 80% of the people that attend our webinars are non-members, and we'd like to have you join the fold. There are a lot of benefits. The Journal of School Health I mentioned, actually, believe it or not, is printed every month. It comes out both online and in a printed hard copy edition. We'd like you to become familiar with the journal if you have not to date. You also get access to a number of school health listservs that are communicating issues directly related to school nursing, alcohol, tobacco, and other drugs, mental health issues, behavioral issues, indigenous health, etc. You would get access to the Pulse, which is on our webpage. It's a blog we're using now. Again, like Facebook, it's immediate with information in real time. You can also join some of the sections I mentioned, the councils that are a part of the American School Health Association. There are discounts on our publications, free CEs, both at our conference as well as on our webinars. You can also become part of the leadership, and we'd love to have you. Another thing that we're just rolling out that members will be excited to know about, and if you're not a member, you may want to think about joining ASHA, in that we have a special group of health insurance options that we've joined into a great contract with a group called Association Health Programs. It offers low-cost health insurance, believe it or not, to a group that's about 300,000 in size. Also a number of life insurance, disability, et cetera, a whole menu of operations that we will be making available, rolling out in early March. At this point, I think we should have most of our people on hand, and we want to find out who you are before we begin with Kevin Jennings. So we're going to ask you to answer a poll. This will only take about 30 seconds, but I do need you to hit the keyboard for us. And we'd like to know, when we get to that point, come up. We'd like to know if you are a school nurse, school counselor, psychologist, a teacher or someone in program staff, or a school administrator, or if you have another type of professional position. Are we active?
Mm-hmm.
So please, if you'll take a couple of seconds, let us know who we're speaking with today. Click.
Still going.
Thank those of you that are responding.
Good.
Can we present the results? Give you a couple more seconds if you would. Please let us know.
83% voted.
Okay, 83% of you. Let's see what, can we see the results? You want to just read them to us then?
Yeah, okay, so they can see the results. We have 25% school counselors and psychologists, so the largest percentage is the school counselors and psychologists.
Makes sense that the largest group, 25%, are counselors or psychologists.
53% are in other fields.
53% other. All right, we have another poll. We'd like to find out what level you're working with. If we could identify K through 6, 7 through 12, K through 12, or other. And that leaves open the possibility that you're working in preschool or at college level. Thank those of you who are responding. This is great. Again, we'll give a few more seconds, especially if you're typing into the other.
84%.
With about 84% responding, what do we have? What's the majority?
We've got 45% K through 12.
K through 12, so almost half of the folks in the basic age ranges of school.
25% 7 through 12.
And about a quarter are in 7th through 12th grade. Okay, this will help our faculty as we begin presentations in just a moment. We'd like to do one more question and poll. This one's simple yes, no. Does your school district or the place you're at work have a formal bullying prevention program? This simple yes, no. We'll take about 20 seconds for folks to give us a yes, no.
Yes, 47 no.
So this is very interesting. About half, 53% of respondents who are with us today are in a formal bullying prevention program in their place of work or school, and the remainders do not have a formal program. Well, this gives us what we were looking for. So without further ado, I'm very pleased to turn now to Kevin Jennings, and Kevin I've known for quite some time. He's served as Assistant Deputy Secretary of the United States Department of Education. There he headed the Department of the Office of Safe and Drug-Free Schools, a position he was appointed to by President Obama in 2009. Prior to his time in the administration, Mr. Jennings founded and led the Gay, Lesbian, and Straight Education Network, or we like to say GLSEN, and he was this is the leading national education organization focused on ensuring safe schools for all students, regardless of sexual orientation or gender identity. So, Kevin, if you're ready, we're ready to move to you. Welcome.
Thank you very much, Stephen, and thanks also to my fellow presenters. I'm kind of the warm-up act for the real experts, and we're going to have a little bit of a flashback to my early days of teaching in the mid-'80s when we had film strips, and I kind of had to go beep to advance my slides because we've been unable to figure out the technical part of it. So I can go to my next slide, please. I'm basically going to talk about three things in my presentation this afternoon. First, I'm going to talk about the prevalence and pervasiveness of bullying. Secondly, the different roles that students play in the bullying phenomenon. And third, some interventions that I would recommend that schools follow in order to reduce bullying. Next slide, please. If we could click again, please. According to the most conservative study done, which is a study done by my former office, the Office of Safe and Drug-Free Schools of the Department of Justice, called Indicators of School Crime and Safety, about a third of students report being bullied at school in an average school year. Next slide, please. I actually think that number underrepresents the nature of the problem, because when you expand the question and ask students if not only have they been bullied, but have they participated in bullying as a perpetrator or as a witness or as all three, the number rapidly rises to almost 3 out of 4. So it is basically the exception to the rule that you will go through school and not somehow be touched by bullying. Most kids are either as witnesses, perpetrators, or victims, or a combination of all three affected by bullying. Next slide, please. Now, one problem that we face with the bullying phenomenon is we only see the tip of the iceberg in terms of bullying, because most kids do not tell adults if they have been bullied. The reality is they are not talking to us for a variety of complicated reasons, one of which is because they don't believe that we'll be effective in addressing the problem. But the reality is whatever you're hearing in terms of bullying, you should multiply that, because the vast majority of bullying goes unreported. Next slide. So let's talk about who gets bullied, who bullies, and who enables bullying. Next slide. one of the great mistakes, I think, in the anti-bullying movement was the zero tolerance approach, which was basically predicated on the idea that there were a few bad kids, and if we could isolate them and throw them out of the schools, the problem would go away. Well, that's just simply not an accurate representation of the problem. And if you look at this chart, you can see that the roles kids play are usually multiple. The number one role kids are witnesses. About 30% are only witnesses. But then look at number two. You have about 15% who are victims and witnesses. Then you have 10% who are bullies, victims, and witnesses. So the idea that somehow it's a few kids that we could isolate and throw out simply does not address the complexity of the problem, which is that kids' roles in the bullying crisis tend to be fluid. Next slide. We do, however, know a little bit about the characteristics of kids who are bullies, witnesses, and victims. Next slide. First of all, if we were to look at what characterizes boys who are bullies, one thing that we know is they have high rates of what we call externalizing behavior. Examples of externalizing behavior are things like ADD, ADHD, oppositional defiant disorder, which is just a fancy clinical way of saying the kid won't do what you tell them to do. But basically, they're kids who, rather than internalizing things when they are upset, tend to externalize them. And they tend to be highly aggressive. Now, I want to be real clear here. I'm not saying that if your kid has ADD, your kid's automatically going to be a bully. What we're talking about are predictive qualities. One other predictive quality we need to recognize is that kids who are bullies often have very negative perceptions of others that are not like themselves. They don't meet, for instance, a Sikh kid and find the hair turban interesting or exciting. They find it negative and something that they think is bad. So when you combine the fact that you have kids who are aggressive, who tend to externalize their behavior, and who generally think poorly of people not like themselves, you have a recipe that leads to bullying. Next slide. Now, when we look at boys who are victimized by bullying, generally we find they are boys who have low social competence. They don't have great social skills, they don't have lots of friends, and they are rejected by their peers. There's a thing called the friendship protection hypothesis, which we don't really understand, but it seems that a kid who reports that they have 3 or more close friends at school is much less likely to get bullied than a kid who has less than 3 close friends. We don't know why 3 is the magic number, but it seems to be. Essentially, to use kind of a crude metaphor, I went on a safari about 10 years ago, and I saw that lions do what bullies do. They tend to pick the gazelle that is separated from the herd. That's the one they attack. That is the same thing that happens with bullies who are boys and their victims who are boys. They tend to pick kids who are already socially isolated, who are easier to isolate further and attack. Next slide. Now, girls are a little bit different in terms of how they bully. And once again, please keep in mind I'm making generalizations here, and they're not one-to-one absolute truths. Whereas the boys who bully are often kind of troubled kids in some ways, the girls who bully are often the good girls, very, very highly popular girls who are actually using bullying to establish or confirm their social power. Next slide. And their choice of victims tends to be more complex. On the one hand, they will often target other popular girls because it's a way of reinforcing their own status, as the famous book Queen Bees and Wannabes title indicates, as a key social leader in the school. But they also like boys because sometimes pick kids who are loners, who are socially isolated and don't have lots of friends. The point is that with boys, it's a little bit easier sometimes to predict who's going to be a bully because the behavior is externalized and so clear, whereas girls often are the so-called good kids are the ones who are the bullies. Next slide, please. When we look at bully victims, these are kids who are bullied who then turn around and bully others. What we find often is that they are kids who have the same low levels of social competency as kids who are victims, but they also are very highly influenced by their peers. In other words, they are kids who've been bullied, who see that the kids who are bullying them seem to be winning social support for such behavior, and then they turn around and bully someone else as a way of trying to win popularity themselves. It's really important to recognize that a study that we did in the Office of Safe and Drug-Free Schools of school shooters found that 75% of those kids have been bullied themselves. My feeling about bullying is that what's going to happen is the kid who is bullied is going to hurt somebody. On the one hand, they may hurt themselves through substance abuse or even suicide, as we've seen in the media over the last couple of years, or they may turn around also and hurt someone else through bullying someone else or through, God forbid, some of the school shootings we've seen in schools. But the reality is a kid who's been bullied is going to hurt someone. The only question is it going to be themselves, is it going to be someone else, or is it going to be both? Next slide. Witnesses also need to be viewed in a complex way. They cannot simply be lumped together as one group. And on this slide, I kind of use a traffic light metaphor to illustrate the different roles kids play as bullying witnesses. On the one extreme are the so-called assistants. These are kids who actually join in the name-calling, who maybe join in the physical harassment. They don't provoke it, but they join in and they support it. Then there are the so-called reinforcers. These are the kids who maybe are not actively bullying, but they provide a supportive audience for the bully. Then there are the so-called outsiders. These are the kids who walk away, who don't want any part of it. And then there are the so-called defenders. These are the kids who, when they see others being bullied, will actively intervene to try and stop the behavior. Witnesses come in a variety of shapes and forms, as this slide demonstrates, and I think part of what we need to do in schools is empower the defenders to help set the social tone. At this point, the bullies and the assistants often are setting the tone for the school. There are kids out there trying to stop this, and we need to create an environment where they are empowered. Next slide. Now, if we try to look at when and where bullying occurs, I apologize for those of you who work in middle schools. I have bad news. Middle school is the worst phase, confirming my theory that when Dante met the seventh circle of hell, he was referring to seventh grade. We see that in sixth and seventh grade, bullying, and eighth grade is really when bullying peaks. In fact, a sixth grader is about twice as likely to be bullied as a senior in high school. Next slide. We also know that it's not just age, but there are other characteristics that make you more vulnerable to bullying. When students are asked what are the main reasons they think their peers get bullied, the number one reason they respond is the way they look at their body size, their appearance. They're too tall, too fat, too thin, too short, too whatever. The number two reason is they are or people perceive them to be gay, lesbian, or bisexual. The number three reason is their gender expression, boys that are quote, too feminine, unquote, or girls that are, quote, too masculine, unquote. And then the fourth reason is ability. And even within ability, there's some complexity because we know that kids who have physical disabilities are about 1.5 times more likely to get bullied, not that, say, a kid in a wheelchair, than a kid who does not have that disability. Whereas a kid who has a so-called invisible disability, like, say, a kid who's on the Asperger's spectrum, is about 6 times more likely to get bullied than a kid who does not have that disability. At the bottom of the scale are the topics of race, class, and religion. I want to point out this is a national study and that these numbers may vary in your community. The reason I personally think these numbers are not higher for race, class, and religion is because our students primarily go to racially, religiously, and economically homogeneous schools. For instance, the main religious minorities who are bullied, Jews, Sikhs, and Muslims, are not distributed equally across America. If you have a large Jewish, Sikh, or Muslim population in your community, those numbers may be much higher. Similarly, de facto segregation continues to exist in many schools where kids are primarily going to school with kids of their own racial background. And, of course, because schools tend to be funded at the local level, that means that kids tend to go to schools with people from their own community who are roughly of the same social status. If you come from a particularly diverse community economically or racially, you may find these numbers change. However, in general, we know that it is appearance, sexual orientation, gender expression, and ability that account for most bullying. Next slide. Now, my old boss, Arnie Duncan, was really famous for saying, no school can be a great school unless it is first a safe school. And I think that that is not just a truism, but something that is very, very fundamental. Scanning of the brain shows that when students are under extreme stress, they simply cannot process new information. And a student who does not feel safe simply is not able to learn. It is a physical, biological fact. It is not an opinion. Students, following Maslow's hierarchy, unless students first feel safe, they cannot focus on learning. Next slide. So what do schools need to do? The first thing I would recommend them do is to help educate faculty, staff, and parents about bullying. I think that we need to help people understand the full range of bullying behaviors, that it's not just being shoved into a locker. It can include cyberbullying. It can include social isolation, rumor spreading, a variety of relational ways of bullying as well as physical ways of bullying. Secondly, you need a clear policy against bullying behaviors, and that needs to be communicated frequently to students, staff, and parents. A clear policy, what I mean by that is a policy that has a clear definition, that has clear enumeration of categories, and has clear consequences, as well as takes preventative measures such as faculty training, which leads me to intervention number 3, which is that we need to make sure all staff, and by all staff I mean everyone, bus drivers, school resource officers, school nurses, cafeteria workers, everyone who interacts with students knows how to recognize bullying behavior and has the skills to intervene to stop that kind of behavior. And then we need to make it clear to all staff members that they must take immediate action when bullying is observed. Finally, to really understand what's going on, we're going to have to gather data to assess bullying. And I would recommend the best way to do that is through anonymous surveys of students. Given that most students do not want to tell adults that they're being bullied, using a simple tool developed through techniques such as SurveyMonkey or something like that can be a very effective way of gathering some useful data. Next slide. With teachers, individual school staff, what I would recommend, go back one, please. First of all, start the discussion about this before there's a problem, preferably on day one. Make it clear what your expectations are around acceptable and unacceptable behavior in the classroom. Secondly, and this is advice for both teachers and parents, watch your kids carefully. Given that most kids do not want to say that they're being bullied, you may find out through changes in behavior. For instance, I had a friend whose son started missing the bus a great deal. And I told her that she should ask him what was going on the bus. And sure enough, when she sat down with him and asked him what was going on the bus, he wasn't missing the bus because he was sleeping through his alarm. He was deliberately missing the bus because he was being bullied every single day at school. And that kind of behavior, for instance, if you have a young woman who has a group of friends who suddenly never talks to them anymore, or you see a kid that used to love school who suddenly develops a problem with absenteeism, I think it's important to sit down and talk with them about what's going on. And I would further urge you not to use the word bullying. I would urge you to not use that word because kids tend to have a narrow definition of what bullying is. They often restrict it to simply physical bullying. And secondly, there's a lot of shame attached with being a victim of bullying, and some kids may not want to own to the fact that they are being bullied. So it's often more effective to simply list the kind of behaviors this young person could be being subjected to, such as is someone being mean to you on the bus, has someone been saying awful things about you online, things like that that are bullying behaviors that students tend to be more likely to admit that those are going on. Third thing to do is take immediate action if you observe or suspect bullying. I always quote Elie Wiesel, the Holocaust survivor, who said, "Silence helps the tormentor, never the tormented." When we're silent, we're basically saying it's okay. Fourth, I would urge you to look at bullying prevention curriculums that you can use in your classrooms. There are great ones for elementary and middle school called, for instance, No Name Calling Week, which you can find at nonamecallingweek.org. Sue is going to go into great length later about the Old Vayas program, another wonderful program. Start using these things. And then finally, remember that your own actions speak louder than words, as do those of your colleagues. I just presented at a conference in Florida on Wednesday, and I actually asked the audience, which is composed of school workers, how many of them felt one of their colleagues was a bully. And 90% of people in the room raised their hand. So when kids see adults being bullies, they start thinking it's okay for them to be bullies as well. Next slide. For students, my recommendation is, first of all, speak up. If you don't feel you can intervene when the bullying incident is taking place because it's not safe to do so, go tell an adult. Number 2, make it clear that you don't think bullying is cool and you don't think bullying is okay, because a lot of people engage in bullying to gain social status. Number 3, support bullied students. And this, basically what I urge kids to do is to remember that often the kids getting bullied are kids who are very isolated. So if you see a kid sitting alone at lunch, invite them to sit with you. And then finally, let's recognize that students can be part of the solution, not just part of the problem. Student leadership through clubs like Gay Straight Alliances, for example, have done a tremendous amount to lower the amount of bullying based on sexual orientation and gender expression in this country. There's no reason to believe that students can't have a very positive impact if we empower them to speak up. And the reality is a lot of bullying does take place out of the view of teachers and other school staff. So we need the students to feel empowered to speak up, because sometimes they may be the only people around to defend the kid who's getting bullied. Next slide. Finally, for parents, I would recommend, first of all, watch your child closely. As I mentioned earlier, sudden changes in behavior may be a sign that bullying is occurring. Number 2, utilize the resources we've put out there for you. When I was in the government, we created a website called stopbullying.gov, which is a one-stop shop for all the resources the government has created on bullying. Take advantage of it. It's free. Your tax dollars paid for it. And number 3, work with staff to find a solution to stop bullying for the sake of your child as well as others. But I'm also going to say something that got me into trouble a couple of times, so I'll say it again. If your kid's not safe, get your kid out of that school. I know this from personal experience. I was relentlessly bullied in 9th grade, and I went to a school counselor and reported what was going on. He asked me, could we go back, please? He asked me which kids were engaging in the bullying, and I named them. They were kids who were more popular than I were, and he had a typical adult response, which was, those are such good kids. I can't believe they would engage in such behavior. And I realized nobody was going to do anything to stop the bullying. So when the first day of 10th grade came, I decided I was not going back to school. My mother finally got out of me why I was refusing to go to school, and she insisted. She approached the school superintendent and insisted I be transferred to a safer school, which she was successful in doing. And as a result, I ended up staying in school instead of dropping out of school and becoming the first of 46 first cousins in my family to get a college degree. But I was this close to being a high school dropout. And I think it's really important for parents not to compromise when it comes to their children's safety. Get them into a school or an educational setting that's safe for them. Next slide. People often ask me why I think bullying continues, and I think the President said it best in the bullying prevention conference he convened at the White House last March, and I'd like to give you a quote from his speech. If there's one goal of this conference, it is to dispel the myth that bullying is just a harmless rite of passage or an inevitable part of growing up. It's not. Bullying can have destructive consequences for our young people, and it's not something we have to accept. As parents and students, as teachers and members of the community, we can take steps, all of us, to help prevent bullying and create a climate in our schools in which all of our children can feel safe, a climate in which they all can feel like they belong. And I know Sue is going to talk about school climate later, and I think that what the President's saying there at the end is really what we have to do. We have to create a school climate in which every kid feels safe and where they feel like they belong at school. Kids who feel like they belong, kids who feel safe, do much better in school. And there's so many bigger problems than this we have solved in American history, problems like segregation, for example. If we can solve those problems, surely we can solve this problem. I think the main obstacle to us doing so is the belief that we cannot do anything about bullying, that it is inevitable. I don't buy that. Surveys show that specific actions we take can reduce bullying significantly, and we simply need to take those actions. Next slide. So I'm going to turn it back to Stephen to lead the rest of the webinar, but I did want you to know how to get in touch with me. If you forget this email address, you can always find me at my website, which is kevinjennings.com. So thank you very much for taking your time to join us today, and I appreciate most of all the fact that you're out there trying to make it better for kids every day. Thank you very much.
Kevin, thank you. We're really tickled to have you with this team today, and I know you're going to stick around and help answer questions. And I need to let the attendees know that they can using the keyboard, send us questions now, and we will begin recording them. And once we've finished our third speaker, we'll be joined by a fourth guest, Dr. Schafer, and we will begin answering your questions. I'd like to point out one more point is that a number of you will be requesting continuing education through the CHES credit systems, and I'll be giving more information at the end of the presentation on that subject area. What you're going to get is an email that'll take you to a link, and from the link you'll finish the SurveyMonkey, and then once we know that, you'll be receiving credit from CHES. Likewise, if you need a certificate of attendance or a certificate of participation, we'll work for that. It's my pleasure to also move now to Dr. Susan Limber. Dr. Limber only recently gotten acquainted with, but her work definitely has preceded that relationship. Professor Limber has worked in the prevention of bullying, and she's recognized as exemplary by 3 separate federal agencies. And it served as the basis, her work, for federally funded design of a national public information campaign. Further recognition of her work, Professor Limber received the American Psychological Association's Award for Distinguished Contributions to Psychology in the Public Interest back in 2004. Professor Limber's consultation on the media campaign was also recognized with the National Kelly Award, an award of excellence from the National Association of Government Communicators, and she is a past chair of the American Psychological Association's Committee on Children. So I'm pleased to turn to you. Welcome, Susan Limber.
Thank you so much, Stephen. I'll be given control here, I think, in a minute, and I'll take it from there. But I'll just say it's such a pleasure to be with you all and to follow that terrific overview by Kevin Jennings, who's brought so much energy to this field and attention to the topic of bullying. I was asked to talk today about best practices in the prevention of bullying. And before I do that, I just wanted to set the stage a bit by first just noting what states currently require of schools regarding the prevention of bullying, then give a glimpse of the range of what schools across the country appear to be doing. I want to spend just a little bit of time discussing some mistakes or misdirections in bullying prevention, and then I'll turn to present some principles of best practice, really sort of picking up on some of the themes that Kevin highlighted. And then finally, I've been asked to give an overview of a comprehensive bullying prevention effort that's present in many schools, the Aldeas Bullying Prevention Program. So what I'd like to do is first take a look at state requirements. Since 1999, which was the year, as you may remember, of the tragic shootings at Columbine High School, there's been a flurry of activity within the state legislatures, as 48 states since that time have passed laws on the topic of bullying. And here you see a map, which is courtesy of the Health Resources and Services Administration, that shows in the darker green those states that have laws now on bullying. As a result of this activity in the state legislatures, almost all states require public school district officials to establish policies against bullying. Now, these policies vary a good bit in their definitions of bullying. For example, whether the definitions include cyberbullying, whether they even define bullying. And they vary in their requirements and their recommendations with regard to key issues such as those that I've listed here, whether they require or perhaps encourage reporting of bullying incidents, and if so, by whom. What, if any, investigation is required following a report. What they have to say about discipline for children who bully, whether they discuss training opportunities for teachers or other staff. They vary in their mention of the importance of prevention efforts and whether they address the need for counseling or specific follow-up services for children who are involved in bullying. So there's a great deal of variability in the state law requirements. There's also a great deal of variability in schools' actual anti-bullying efforts. And to my knowledge, there's little or no official tracking of schools' anti-bullying efforts. This is a non-scientific assessment by me that suggests that there really is a wide range of responses. So while some schools are still not addressing bullying in any systematic and conscious way, often, I might add, despite having policies on the books, many others are doing something. And in my experience, many more are than were just even a few years ago. What they're doing varies a good bit from school district to school district and from school to school. So as you can see here, some are attempting to address bullying problems by raising awareness through assemblies for students or training for staff or perhaps speakers at PTO meetings. Others, in fact, with the support of many state laws, are focusing efforts on reporting and tracking bullying incidents. Some focus on discipline of students who are involved and have encouraged harsh zero-tolerance policies. I'll come back to this in a minute. Some have focused on social skills training for victims of bullying to increase their resiliency. Others have encouraged individual or group treatment for children who are bullied or those who bully others or both. Some use mediation or conflict resolution programs to address the problem. Quite a few have looked to implement relevant curricular approaches. And then finally, I think an increasing number of schools are adopting comprehensive approaches to bullying prevention, whereby the entire school is engaged in a variety of efforts to prevent bullying and to deal with bullying when it occurs. Now, unfortunately, some intervention and prevention strategies that have been used by well-meaning educators and advocates are not supported by research or our understanding of what's best practice. And I'd like to highlight just a few. As Kevin mentioned, some schools have adopted zero tolerance or perhaps 3 strikes policies towards bullying, in which children who bully others are suspended or expelled or perhaps even transferred to alternative settings. These policies, sometimes also called student exclusion policies, as Kevin mentioned, raise a number of real concerns. Number one, they potentially affect a large number of students. Remember Kevin's figure that at least a third of students report being involved in bullying. Secondly, threats of very severe punishment, such as suspension or expulsion, may actually discourage children and adults from reporting. It can have a chilling effect on their willingness to report bullying that they experience or that they see. And third, bullying can be an early marker, and often is, of other problem behaviors. So children who bully are in need of positive, pro-social role models, including adults and students in their school. Now, of course, in some cases, public safety may demand extreme measures, such as a suspension or expulsion, but they shouldn't be a focus of bullying prevention policies. So secondly, let's look at conflict resolution. Conflict resolution or peer mediation strategies are common for dealing with conflicts among students. Some schools use peer mediation and conflict resolution to address bullying problems as well, which is not recommended. Why? As Kevin alluded to, bullying is a form of victimization. It is not a conflict. Mediating a bullying incident may send very inappropriate messages to students who are involved. You're both partly right, you're both partly wrong, we need to work out this conflict between you. Not appropriate messages. Third, mediation really may further victimize a child who's been bullied. Maybe the last thing that they want to do is face their tormentor. Now, in some cases, restorative practices certainly may be appropriate, but these typically require a good bit of time and training by professionals, situations that are not common to most peer mediation programs in schools. Another strategy that some schools use to address bullying involves group therapeutic treatment for children who bully, perhaps involving anger management or skill building or empathy building. And although, again, well-intentioned, these group interventions are often very counterproductive, as we know that group members tend to serve as poor or excellent, depending on how you look at it, role models for each other, and they reinforce each other's antisocial and bullying behaviors, so not recommended. And finally, I want to talk a little bit about simple or short-term solutions. Often school administrators and their staff adopt a short-term or perhaps a piecemeal approach to bullying prevention. It may be the topic of a staff in-service training on one day, a PTA meeting, a school-wide assembly, or maybe lessons taught by individual teachers for a week or two. And although each of these efforts may represent important initial steps in adopting a more school-wide or long-term strategy, they likely will do very little to significantly reduce bullying problems. So with these cautions in mind, I'd like now to turn to highlight 10 elements of best practices in bullying prevention, many of which overlap nicely with Kevin's suggestions of what every school and every teacher should do. The first element of best practice is to focus on the social environment of the school. To reduce bullying, it's important to change the climate of the school and the social norms with regard to bullying. It really has to become uncool to bully, cool to help out students who are bullied, and normative for staff and students to notice when a child is being bullied or left out or is at risk of being bullied. And this requires the efforts of everybody in the school environment: teachers, administrators, counselors, other non-teaching staff, bus drivers, nurses, school resource officers, as well as parents, and in fact, of course, students themselves. Second recommendation, similar to Kevin's, is to assess bullying at your school. We as adults are not always very good at estimating the nature and prevalence of bullying in our schools. And frequently, we are, in fact, quite surprised by either the amount of bullying that students experience, the types of bullying that is most common, or maybe the hot spots where it is happening. So as a result, it's often quite useful to collect data from students. National data is great, but local data can be even more compelling. The most common way of doing this, as Kevin alluded to, is administering an anonymous questionnaire to students about bullying, pencil, paper, or online. And there are a number of benefits, I think. The findings from collecting this local data at your school really can help motivate adults to take action against bullying. The data also can help administrators and educators to tailor a bullying prevention strategy to the very particular needs of your school. And very importantly, the data can serve as a baseline from which you can then measure your progress in reducing bullying. I want to also mention it can also be very helpful to collect data either formally or informally from staff and parents who often have very different perspectives about the issues than do the students themselves. Third element of best practice is to seek out support for bullying prevention. Bullying prevention should not be the sole responsibility of an administrator, a counselor, a teacher, or any single individual at a school. To be most effective, bullying prevention efforts really require buy-in from the majority of staff and from parents. Early and enthusiastic support from the administrator is, of course, necessary, but it's often not sufficient. It's also important to get the commitment from the majority of your classroom teachers, for example, who will be asked to play key roles in these efforts. Parents, of course, are key partners as well, and we really want their input early as possible in the process. All administrators, faculty, and staff at your school, as Kevin mentioned, really should be well-trained in bullying prevention and intervention. This training can help your staff better understand the nature of bullying, its effects, how to respond if they observe bullying, and how to work with others at the school to prevent it from happening. And it's critical that this training not be limited to teaching staff and counselors, as is often the case. We really need to make an effort to educate all the adults in the school environment who interact with students, media specialists, school resource officers, custodians, on down the list. They all play key roles. A fifth element of best practice is to establish and enforce school rules and policies about bullying. So let me start with the school rules, which are often most visible to students. Many schools have found it important to develop widely posted rules about bullying behaviors that address not only the behavior of children who bully, for example, appropriate rule might be we won't bully others, but also to develop rules that are directed at the behavior of those who witness bullying. These rules can then encourage students to help out those who are bullied, in particular to report it to an adult, which is so critical. So in other words, I think it's important to make clear that the school not only expects students not to bully, but that it also expects them to be good citizens, not passive bystanders, if they're aware of bullying or if they're aware of students who appear to be trouble. So developing simple, clear rules about bullying, I think, can really help to ensure that students are aware of our expectations. Now, as I mentioned earlier, under state laws, most school districts are required to develop school policies about bullying. Take a close look at your district policy, work to approve it if you need to, but don't ignore it. Most laws now include cyberbullying within their definitions of bullying, so with the advice of your legal counsel, perhaps look to incorporate cyberbullying into your policy as well. Bullying, we know, tends to thrive in those locations where adults aren't present or are not as watchful as we might be. So once school personnel have identified hotspots for bullying from students, look for creative ways to increase adults' presence in these locations. All of the adults within the school environment should see it as their responsibility to be vigilant to bullying. Kids really can't afford for anybody to turn a blind eye. Of course, not only should we adults be watchful, but we also need to be prepared to intervene appropriately and very quickly if we observe or if we suspect bullying. So school administrators may want to ask themselves whether all the adults in their building are prepared to intervene if they observe bullying or if they believe it may be occurring. So are we prepared on the spot to step in and say or do something? And secondly, do we have a follow-up plan? Certain staff then should be designated and trained to hold sensitive follow-up meetings with children who are bullied and separately with children who bully. And of course, staff should involve the parents of these involve students whenever necessary or whenever possible, actually. An eighth element of best practice is to focus some classroom time on bullying prevention. It's so important that bullying prevention programs include a classroom element, as difficult as this may be for some schools to do. Teachers, with the support of their administrators, really should be encouraged to set aside 20 to 30 minutes every week to discuss peer relations in general, bullying in particular on occasion. These meetings can really help to build a sense of community in the classroom. They can allow time for really candid discussions about bullying and the harms it can cause. They can give students tools to address bullying problems and really help teachers keep their fingers on the pulse of students' concerns. Kevin mentioned the importance of empowering defenders. This is a great time to really give kids these skills and strategies and encouragement to be defenders. There are lots of terrific tools to help teachers do this. Videos, children's or teens literature, role play opportunities, and encourage you to look for these good resources. I want to add that anti-bullying themes and messages can and should also be worked into and incorporated throughout the school curriculum. A ninth element of best practice is to really look to coordinate and integrate prevention efforts. Many schools, of course, are working hard not only to address bullying, but also to address and prevent other social and emotional problems. So it's useful to coordinate and, wherever appropriate, integrate these prevention efforts to ensure that messages are consistent and that our time, our energy, and our resources are being well spent. In my experience, many schools have found it very helpful to form a representative team to coordinate bullying prevention and other similar efforts. And this team really helps to ensure that the important voices are heard of all members of different constituencies and all members of the school community are really actively engaged in these efforts. And finally, there really should be no end date for bullying prevention activities. Bullying prevention should be woven into the entire, really woven into the school environment itself. So with that, I wanted to note that a recent meta-analysis by researchers Topey and Farrington concluded that school-based bullying prevention efforts programs can be effective. It's good news. They found that they resulted generally in a 20 to 23% reduction in bullying overall, and that those that were inspired by the work of Dan Obeas, those that, in other words, that embrace a comprehensive approach to bullying, were the most effective. So I'd like to just take a few minutes to give a brief overview of this one program. It's not the only program out there. It may not be, there's not a one-size-fits-all program for every school. But I'd like to describe the Obeas program, which was developed by Dan Obeas in Norway and which has subsequently been implemented fairly widely within the United States and elsewhere.
So can I ask you to wrap it in two?
Sure can.
Okay.
So the goals of the program are very straightforward that you see here. We want to reduce existing problems, prevent new problems from cropping up, and more generally improve the climate, achieve better peer relations at school. This is a comprehensive program that includes interventions at different levels, as you see here. School-wide interventions, interventions within the classroom, one-on-one individual interventions, and ways of engaging the broader community. Just to give you a flavor of some of these. It's a primary prevention program, so there are quite a few program elements, as you see here, that are designed to affect and touch everybody at the school. Let me just mention a few. We have found that a coordinating committee is so important to be established and serve as the school's engine behind the program. Again, as I mentioned earlier, it's great to have a representative team, 8 to 12 members from all constituencies in the school that plan, implement, fine-tune the program, keep it going over time. This committee receives really extensive training, and they, in turn, train everybody else at the school. They also receive ongoing consultation to help make sure the program is implemented with fidelity. The Obeas Bullying Questionnaire is implemented prior to program implementation and every year thereafter to measure progress in reducing bullying and helping the staff to tailor the program to their specific needs. I mentioned earlier the importance of school rules against bullying. Very simple rules are developed to guide the behavior not just of kids who bully, but those who witness bullying in their school. And schools are invited to refine and review their supervisory system. Where, again, are the hotspots occurring? How can we redouble our efforts in all of these hotspots to make sure that kids are safe? To give a look at some of the classroom activities, what takes place in addition to really enforcing school-wide rules against bullying in the classroom, class meetings are critical. They're held weekly. It's time to put books away and for students and teachers to really build a sense of community. As I mentioned earlier, to talk about bullying, peer relationships, and practice strategies, increase empathy, and learn about the harmful effects of bullying. In fact, this component's been so important that research has shown that teachers who systematically held class meetings saw larger reductions in bullying after 1 year. Also encourage schools to hold not just class meetings with students, but periodically with parents. Again, important for building understanding and a sense of community.
So we're going
individual interventions, I'll wrap it up in just 30 seconds if I could.
Thank you.
Great. In addition to close supervision, again, really ensuring that all staff intervene on the spot when bullying occurs, that there are follow-up meetings as needed, and there may well be the need for individual intervention plans and referrals for students who have been bullied to cope with the bullying that they may have experienced, and for kids who bully to redirect their behaviors. And finally, just to mention that, of course, bullying doesn't stop at the schoolhouse doors, so it's important important part of this program to reach beyond the school to engage community members in the school's program and to send the message beyond the school doors about the importance of prevention of bullying in the community. And finally, just provide information of where I can be reached. Kevin mentioned stopbullying.gov is a terrific resource for information. And for those who want information on the OBEAS program, you can find it at obeas.org. Thanks so much.
Sue, thank you so much. I'm sorry to rush you with such great information. That was very, very, very good and very helpful to the project. I would like to just simply do one more poll and ask folks to step to their keyboard before we go to Bridget Clemente. And I'm curious, as we look at it, how often do you see cases, cases of bullying in your place of work? Is it daily, 2 to 3 times a week, a few times a month, rarely, or never? We'll give you just a few seconds. And while folks are responding, I appreciate the questions. Please keep them coming. We do have one quite frequently that we're seeing. And yes, the slides will be available from all of our speakers on the American School Health Association webpage, which is ashaweb.org. Still getting some votes. We'll wait just another second. You can continue to ask questions. Our faculty will be responding after our third presenter, Bridget Clemente. So what do you have for results? What do you think?
29% or a few times a month, 27, 2 to 3 times a month.
So about half of our folks are falling between the middle two markers of 2 to 3 times a week to a few times per month. Thank you very much for responding. This helps as we move forward with this project and, of course, as we plan for the second webinar on April 17th. I will turn now to Bridget Clemente as we set up her slides. Bridget provides leadership, strategic planning, implementation, coordination, and management for the Children's Hospital of Wisconsin and health systems community services programs, including school health, school nurse programs, Children's Education Center, CHEC, the Injury Prevention and Safe Kids and Health Promotion, and access to services. Bridget is also a member currently of the ASHA Board of Directors, and we're pleased to turn the podium to Ms. Clemente.
Thank you, Stephen. And I will admit that I wasn't nervous when our presentation began today, but certainly being in the company of Kevin Jennings and Sue Limber has made me a little bit more nervous. But thank you both for sharing your wonderful best practices. And I was asked to share some best practices and also share how those in particular are applied to our e-learning program. So we have a little bit of a unique approach, and you may be asking yourself, why does a children's hospital want to get involved in preventing bullying? To some of you, it might seem very obvious, but as a children's hospital, we see the cases of bullying from mental or emotional health to physical cases and other incidences that we interface with children and their families. And we really realize that there's an important opportunity for children's hospitals across the nation to become involved with preventing this from happening within schools and communities throughout their communities themselves. So Children's Hospital of Wisconsin is located in Milwaukee. We are a nationally recognized freestanding pediatric hospital. We lead a number of community resources, as Stephen had mentioned, for injury prevention, for health education, and about 5 years ago we created bluekids.org, our e-learning program, to reach throughout the state and beyond to offer a number of these components around how to keep our own children here in Wisconsin and throughout the United States healthier. It is the mission of Children's Hospital and Health System here in Wisconsin to have the healthiest pediatric population in the nation. And so we are charged with that vision, and we want to make certain that we too, like Kevin and Sue both shared with you, that we are using evidence-informed practices and focusing on over 100 research studies. You've heard from many of them today, including all of the things that Kevin Jennings had shared. And just as a little bit of a side note, it was ironic that during the development of much of our program, we had the opportunity to hear Kevin Jennings present at the ASHA conference. And it was at that moment in time that Richard Schafer and myself looked at each other and said, we're glad to hear that we were on the right track. And so we looked at certainly the information that Kevin had shared. We are great advocates of the work that Sue and her organization does in the Obvious Bullying Prevention Program. And so these are just a sampling of some of the research studies and best practices that we focused on in the development of our program. We also identified through the development process something that we fondly call the Big Ten. Here in Wisconsin, being great Badger fans, we often reference the Big Ten. And these are to the schools and administrators and teachers and counselors that are on the webinar today. These are the 10 things that we feel, and many of them were covered in different ways with Kevin and Sue's presentations. But these are the top 10 things that we absolutely feel need to be implemented and integrated within a quality, effective bullying prevention program that's going to showcase results. And so as many had mentioned already on the phone, it does need to be inclusive of the community. It does absolutely need to include all the staff that are present and interface with the students. And I love how Sue called out specifically the bus drivers. We have experience in training bus drivers and food service workers and others because of the important role that they play and because of the fact that they are often in what we call in our reference hotspots where supervision might be more limited, and that's where bullying occurs often more in those hotspots than not. You can see a couple of the other pieces are around class time, which again others had talked to, and the importance of intervening consistently. So again, whether it be that bus driver, the food service worker, the reading specialist, or whomever it may be, that they all have an opportunity to have consistent messaging and consistent intervention. So as we move forward in our program development, we compiled a bit of a list of what we absolutely must have when we put together a program and what would be nice to have. And I think that a lot of these would be true to many of the folks that are on the phone joining us today as well. And so in the must-have list, we certainly have to develop programs that are evidence-informed or evidence-based and put those into application. We certainly have to, at least according to us, meet the national health standards. We needed to look for something that was a student-wide curriculum. So we went into this developing a middle school bullying prevention program. And we knew from the research that we had conducted and that we had read that it was critical to be able to roll something out school-wide, 6th, 7th, and 8th grade, to really get to what both Kevin and Sue again had mentioned, the importance of influencing, if you will, the school climate. We needed to have a focus on the bystanders. Kevin had mentioned this during his presentation that so many folks, whether it be adults truly or students, are bystanders, and we knew that we needed to move forward with that being the focus of our program and interventions. And as we've heard again much today, the importance of assessment and evaluation can't be understated. And so then we developed a little bit of a list of what we really would like to have or would be our nice to have. We have the opportunity here, being part of a wonderful hospital, that we have content experts from reputable institutions with medical backgrounds and others, and we wanted them to be a part of our development. We have a little bit of a different and unique approach to the programs that we develop, and that is that they're game-based. So rather than focusing on some more paper-based processes that might be available, we wanted something really engaging and interactive for students that would be very much delivered in the way that they are learning today by everything that they use and meet them really where their technology interests are. We believe that technology is a wonderful vehicle to deliver the program, but there is a critical need for the school counselors or school teachers who are participating and facilitating in the program to really bring that education home. Because in order to understand what's happening in their community, they need to engage in classroom discussions and classroom activities that bring those learning lessons home right into their own community and classroom. I appreciated Sue mentioning the importance of delivering with fidelity. We felt as though developing an e-learning application and program allowed us to ensure that fidelity, to ensure that the students were all receiving the information as it was designed to be delivered. And then we absolutely felt it was critical to continue to have a teacher and staff training component. So just to provide you a little bit of a framework of how we put all these best practices together and created our e-learning program, as I shared, we decided to move forward with both 6th, 7th, and 8th grade. We use a learning management system to deliver our programs on, so it allows for students to have their unique student logins and passwords. It allows for that anonymous user. We don't, although we solicit the surveys and assessments through that, we don't know who those individual students are. And the classroom teacher or counselor is able to assign those logins and passwords and track the progress of each of the students individually. Certainly, we have built in both summative and formative assessments, including a school climate survey, and we use the obvious bullying prevention survey tool. And again, I had mentioned the importance of having the blended approach, the online or e-learning components, in addition to the classroom discussion and activities, and a breakdown of the sessions. So last year when we launched our program in October of 2011, last school year, or excuse me, of 2010, excuse me. Last school year, then we touched over 15,000 students, and we had 4,000 of those students enrolled in a research study, and we'll be sharing those results in April as the second component of the series of this webinar. So getting a little bit more into the detail of what the components included. Using the game-based format, we developed a branching storyline where students play a character and move through the sequence of the game, much like a choose-your-own-adventure kind of a book, where they go through, they interact with students who are fictitious students as part of the program, and their choices and consequences lead them down a specific path. We have videos where students can see other students in action, so to speak. The exploratory playthrough allows for self-paced learning and adventures as the students go along. The games are certainly an opportunity for us to use those as quizzes without the students realizing that, and so the students have the chance to review their knowledge in a very fun way. End of action reports provides feedback immediately to the students based on the choices that they made. They're able to see if they were more likely to be a bystander, if they were more likely to be a bully, or what their consequences may have been. And then we allow not only for that discussion that happens in the classroom, but also the discussion that is, again, very much the way that students are comfortable speaking to one another through text and through Facebook and other social media. We engage that as part of our program, allowing for that informal social learning and exploration and discussions to take place. Just a little snapshot on what our teacher and staff training, Sue had mentioned the importance of continuing the program in an ongoing way, and that's exactly how we see them all working. So the student modules are taking place as the staff modules are taking place, and the professional development components are being launched with all teacher and staff. The one thing that others did not spend a lot of time on, that I'll spend a little bit more time on this particular slide, is the importance of the school champion. So the teacher and staff training module, again, is consistent for all the staff, looks at school policies, certainly speaks to the importance of restorative justice and community and parent engagement, school climate assessment, intervention strategies, etc. But it is the school champion that holds all of these pieces together. And so oftentimes our school champion may be a counselor, maybe a classroom teacher, maybe a parent, but it's that school champion that really holds all the components of each individual program and the delivery together. So I'd like to give you a little bit of a snapshot on what our program looks like. I have prepared a bit of a video that showcases this. And if it is a little bit jerky on your slides, I will have a link as part of the archive presentation as well.
Which sort of a bullying problem? No, you're not.
You're being such a jerk. Hey, Nick.
I bully people, but it wasn't for one.
When you see someone getting hurt emotionally or physically by a bully, your usual reaction is to laugh.
At my school.
And so as others had shared their contact, I wanted to be certain to share my contact information as well. And in case you didn't catch the video, I did share that link as well. So thank you again for the opportunity, and at this point, I pass it back to Stephen.
Bridget, thank you very much. We really appreciate the contributions of all three of our faculty, and we have gotten some wonderful questions for you. But before we get to that, one of the things that struck me, and I get this prerogative as your MC, is looking at some of the solutions that have been tried and some of the efforts perhaps coming out of legislatures, not educators, or people that are making policy that perhaps aren't really in the schools daily. And I'm reminded of H.L. Mencken, who said, for every complex problem, there is an answer that is clear, simple, and wrong. And I hope we work beyond those issues, and I really appreciate all of our presenters pointing out some of the issues and approaches that have not worked. Are we open now with all faculty? Well, I think we can move now. We had a direct question for you, Kevin, and I hope you're still with us. So they're looking at, in your experience, what can schools do for bullies to help them? And we're really looking at, we know those kids are hurting too, and how can we better help the bullies?
Well, I think that there's a couple of different things I would say in response to that. First of all, one thing we know about bullies is that this tends to follow them into their adult lives. There's just a longitudinal study done in England where they followed kids from age 15 to age 50. And what they found were kids that were bullies in school were much more likely to be convicted of crimes, were much more likely to be unable to hold jobs, were much more likely to simply have unsuccessful lives. So the most important thing we can do for kids who are bullies is to teach them this kind of behavior is not acceptable, which is a message maybe they've never gotten before because they may come from homes where bullying behavior is routine or come from communities where bullying behavior is routine. And the fact is that behavior, when they take it into the real world, is going to tremendously disserve them. So step one is to educate them as to what is appropriate behavior, because maybe nobody's ever done that before. The second thing to understand often is a kid who's a bully, there's usually something going on there. Perhaps there's been abuse at home. Perhaps they themselves don't feel like they fit in or they belong. That I would argue where there's smoke, there's fire, and I would try to get beyond the presenting behavior. You know, counselors will often talk about the presenting problem and the real problem. The presenting behavior is the bullying, but the real problem is something else. And I think some counseling to get at the real problem is also a wise thing to do. So I think it's a twofold job. First of all, start teaching these young people what appropriate behavior is, and then second, to uncover why they're engaging in such troublesome behavior in the first place.
Excellent. We have another question, this one directed to Sue. Sue, a very complimentary comment to begin with, but then the question says, can you underscore the fact that all staff need to be involved in cyberbullying efforts, not just the technological folks who often are not aware of prevention, intervention, or risk protection, really reaching the full staff in the school?
Yeah, so an interesting question focusing on cyberbullying in particular. I think most folks would agree that for the more traditional forms of bullying, most of which occur at school, every staff member really needs to be involved because they may encounter it. Interesting question about cyberbullying, because most of cyberbullying doesn't occur at school but occurs away from school. But we know that the effects of cyberbullying can really bleed into the school environment. And we also know there's a huge overlap between children who experience cyberbullying and those who experience traditional forms of bullying. So I would argue that all staff really need to be trained to not only understand and recognize the importance of intervening if they suspect traditional bullying that occurs at school, but also, you know, what are warning signs that a child might be involved in cyberbullying? I think educators have a real duty to work to prevent all forms of bullying, including cyberbullying, because of what I just mentioned. It affects kids at school, and every adult has a role to play there as well.
Very good. Bridget, we've got a question coming into you about the cost of your program. Is your program free?
As you can probably tell by the development of the program, it was unfortunately not free to develop, so we do have to charge some nominal fee forward to the schools. And we have been able to secure enough funds here in Wisconsin that we do make it available to our schools throughout Wisconsin at no cost. But we have some, with the unique logins and passwords, we do have some costs that we need to cover as we move forward and make it available to others outside of Wisconsin.
Okay. I have a toss-up question, which I'll offer to any of you on the faculty, and it relates to someone who's a court-appointed special advocate. And this individual has a case of a child who's telling the advocate about being bullied, but the child doesn't want to self-report. So the question ethically becomes, should the advocate report this to the school? And a little bit further with the second part is, are schools receptive to CASA reports on bullying? You don't have to all speak at once.
This is Dick Schafer. I'll take that a little bit.
Come closer to the microphone, Dick.
Come closer.
Being a former high school principal for many years and now having the opportunity to work at Children's, I think, yes, schools are very receptive to hearing bullying, but not at the superintendent level, at the principal level or at the counselor level. I don't necessarily believe that at the initiation of the reporting you have to identify who the person is that is in fear at that particular moment, unless, of course, they're afraid that he or she may hurt themselves or someone else. But I think working on the school policy and climate and so forth and seeing what the school is doing in terms of moving forward, and that is the first step. And then if that doesn't hold any water or come forward, I think then you need to take more serious and directive measures. But I think schools at this point, because of the publicity, a lot of the work that Kevin has done, a lot of the work that Sue has done with OVAS. People are scrambling for programs that are effective, evidence-based, and informed-based, and they are willing to listen.
I want to say thank you, Dr. Dick Schafer, for stepping in on this one. Does any of the other faculty want to add?
Just wanted, this is to highlight something that Kevin said, which is that we often know that bullying often doesn't get better without a light, shown on it. So adults in the school environment really need to know about bullying that may be existing for this child's sake as well as others if it's prevalent. There can be, of course, sensitivities and sometimes some really good reasons why kids are reluctant to report. So just to encourage that be done very sensitively and carefully, but I would argue that the school really needs to know that there are issues going on in most cases.
Okay. Here's a question I think that many of us have faced in school situations in various ways, and that is, what is the best approach to work with a parent who thinks their child is innocent and turns it around to say that the school is simply not doing their job? My child's not a bully.
Well, this is Sue. I'll jump in first, and others I'm sure will have experiences with this. It's certainly not at all uncommon. We as parents don't want to learn in many cases that our children are acting inappropriately, and getting the message that our child is bullied can be particularly painful for some of us. For other parents, they may be in fact encouraging this sort of behavior. So it can be a very difficult thing, I think, for schools sometimes to deal with parents of children who bully. I think it's critical to have as much concrete evidence of specific actions that were taken. You don't want to go into a discussion with parents with hearsay. You also want to be careful in how you phrase it. You never want to call somebody's child a bully. You want to talk about the behavior, talk about your concern for their child as well as the safety of others. The data that Kevin cited really expressed your concern for the future behavior and well-being of their child if this behavior isn't turned around. So I would say have evidence, approach it very collaboratively if at all possible, not accusing them or their child, but rather looking for a solution to the behavior.
Very good. We're going to do just a couple more as we approach the top of the hour. What do you do when you catch someone in the act of bullying? What should be your immediate response? What's appropriate?
This is Kevin. I would say a couple things about this, primarily as a former high school teacher. I think the first thing to do is to draw attention to the behavior, not the individual. To say immediately, we all know this kind of behavior is not tolerated at X school, and I'm not going to put up with it in this classroom, so I don't ever want to see it again. So that you're making clear that it's not that there's one bad kid that's the problem, but it's the behavior that's a problem. And then I think it's important to follow up separately in a one-on-one meeting with the young person to understand what's going on. I think it's very, very hard in the heat of the moment to have a thoughtful dialogue. It is very important to respond immediately in the heat of the moment, because if you don't, basically what kids are learning is that this is acceptable behavior. But I also think it's really important to make sure that intervention is done in such a way that it does not stigmatize that young person, because often what kids will remember is Mr. Jennings was mean to me, not I was engaging in a bad behavior.
I think that's a really good suggestion, Kevin, and one of the things that I think is really important is that you look at the restorative practices, and if you know the four components of the restorative practices, you never make accusations of the perpetrator themselves. It's not a personal thing. It's a behavior you want corrected, not the punishment of the perpetrator. And the other thing I was going to mention from I think when Sue was talking about having good evidence, if a person is a bully, he's not just bullying one person. So as you're looking at working with the parents and you're collecting that evidence, you need to be sure that you have experiences of all the situations that this person may have been involved in. So it just can't be a one-on-one thing, because if it is a one-on-one thing, there's always that level of possible retaliation. So.
Excellent, Dick. And at this point, we are at the bewitching hour, and I have to say thanks again to Kevin Jennings and Sue Limber, Bridget Clemente, and Dick Schafer. This has been wonderful. We have a variety of questions that, of course, we have not been able to get to. You've got the contact information there for all three of our faculty. You can send questions to them. We will be posting the slides from the presentations on the ASHA webpage, and we encourage you to go there. And again, if you're not a member, we encourage you to join. We will be doing part 2 of this webinar series on bullying prevention. It will be focusing on evaluation of programs and a big sort of a large picture macro look at bullying prevention programs. Again, that's April 17th. I would also want to remind folks to look at our webpage, consider submitting a paper. We definitely would like to see more on bullying prevention for Texas. My apologies. And if you are interested in credits, you will be receiving an email if you join this webinar and follow the instructions. And thanks, everyone, for joining us. This has been very illuminating. Thank you all.